For our next presenter, she is from Dinalupihan, Bataan, Jonah Pauline Manda. Ayan.
Hey, you're here! Woo!
Yes, it's
Doc
Yeah, hi,
Jonah.
Jonah.
So you
Hello.
can start sharing your screen na
thank you,
Doc
She's
Jonah.
light siya.
Ano, sa akin pala, sa akin to, no? Sa akin to.
yes.
Hold on, ako
Yes.
pala mag-ready. Hold on. Nagpapanik ako, wait lang.
Kaya mo yan, Chico.
It's here. Lupihan, there you go. Alright. Okay.
Good
So, yan.
luck, Miss
I'll,
Jonah.
Doc Jonah, the floor is yours.
Okay. Yes po, so good evening everyone, broads and sisters. So I am Dr. Jonah Manda, and I'm here to present excellent and innovative practices against COVID-19 in Dinalupihan. Next slide, please. So this is an overview of my presentation. Next. So for the situational analysis, Bayanihan to Heal as One Act is in line with the state of public health emergency declaration in the Philippines. And as a result, the provincial government of Bataan declared state of calamity and activated its Bataan Interagency Task Force and Emergency Operations Center last March 2020. Next. Dinalupihan, Bataan is a first-class municipality that is bounded by Bulubao, Florida Blanca, and Olongapo. It has the second largest population in Bataan with around 114,000, 46 barangays, and 3 rural health units. Next. So as of July 15, 2020, there has been confirmed 58,850 cases in the Philippines and 1,614 deaths. While in Dinalupihan, there has been 9 confirmed cases, 20 suspects, 0 probable, and 2 deaths. Next. So this is our prevention and control system in Dinalupihan, consisting of a 6-pronged strategy. So in order to safeguard the health and welfare of our healthcare workers. Next. So for communication, next slide please. So as early as February 3, 2020, we have gathered different stakeholders from the mayor, vice mayor, barangay captains, public and private school teachers in order to meet with them regarding MDRRMC meeting and municipal orientation on COVID-19. So we have oriented them and taught them signs and symptoms as well as provided information on community-based prevention. Next slide, please. We have also activated the 24/7 command center, which can accommodate calls, queries, and accommodate the concerns of the Dinalupiheños any time of the day. The COVID hotline in Dinalupihan and Bataan is part of the referral system across different RHUs, checkpoints, and quarantine facilities, and it also forms a part of passive surveillance for reporting of cases, for reporting of symptomatic patients with travel history. Next. So also, we have made a Viber group in order for us to be able to manage and have a bird's eye view of OFWs, LSIs, and citizens with essential travel across Bataan. So with the help of the Secretary to the Sangguniang Bayan, the Barangay Captain, and the municipal doctors, we are able to call the patient one by one and inform and advise them about the different health protocols in Bataan. Only then can we issue a signal for travel authority in the municipality. Next. Next, please. So these are the different health protocols that we enforce for inbound individuals. First, we make them sign a consent form for home or facility-based quarantine. We, the doctors, check the eligibility of the home quarantine site and perform a medical assessment consisting of age, signs and symptoms of the patient, comorbidities such as hypertension and diabetes, and pregnancy status. We also give prevention guidelines and properly endorse them to the BHERT. Next slide, please. So this is an online tracking of the COVID-19 suspect, probable, and confirmed cases. So this is participated by midwives, nurses, and the different members of the disease surveillance unit. And it has the added option of providing an automated summarized statistics for RHU and barangay in the community. Next slide, please. We also use other online platforms such as Zoom, Facebook Messenger for daily reporting of COVID suspects, and use of Viber for online communication. Next slide, please. So for the engineering controls, RHU and BH is designed to remove opportunity for pathogen exposure. Next slide, please. So we have the triage and holding area for patients, wherein patients are screened for respiratory signs and symptoms prior to consult with a doctor in the RHU. Next slide. At the Barangay Health Center and hand washing station at the Municipal Hall. Next slide. So we have also prepared swabbing booths in order to safeguard the protection and safety of our medtechs and nurses. This has been featured as a best practice because it is available in each RHU and it is daily cleaned and disinfected, care of the assigned sanitary inspector. Training on proper swabbing is also done by the Provincial Health Office. Next. So for administrative controls, we have enforced different work policies and procedures to safeguard the health of our healthcare workers. Policies on alternative working arrangements have been arranged, such as flexible work week for doctors around four days per week, physically present in the RHU and 24/7 on call through phone communication. And also we have enforced 3-day work week for vulnerable health staff, such as senior citizens and those with uncontrolled comorbidities. We also have the no face mask, no entry policy in all our business establishments and healthcare facilities. And we have also provided free shuttle for healthcare workers and other LGU employees during ECQ and MECQ. Next. So for PPEs, next. For PPEs, from the initial onset of the ECQ, we have identified and distributed PPEs such as face shield, gloves, and coveralls to our doctors and RHU staff who are undertaking daily duty at the RHU. Next. So these are some pictures of our medical technologists and allied frontline healthcare workers during the different activities of the municipality. And we have also provided PPEs to our BHW so that they can carry on their tasks more smoothly during barangay visits. Next slide. So for facility quarantine and testing, we have identified Dinalupihan Elementary School as an adequately test COVID center, and we have conducted inspection and visit with the provincial officials and MHO and RHP. So these are some of the parameters that we considered. Space requirements such as individual rooms with bathroom, staff requirements such as facility nurses, sanitary inspectors, etc. Supplies and PPE such as aforementioned, and also infection prevention and control measures, and last but not the least, support services such as dietary and cleaning. Next slide. So we also conducted a training for healthcare workers and frontliners who will be on duty prior to the opening of the LGU quarantine facility. So rules and regulations at the LGU quarantine facility were discussed, and also proper training on donning, doffing, and disinfection were conducted, as well as the proper referral system with MHO, RHPs, and barangay captains. Next slide, please. So in order to increase the testing capacity of our municipality and our province, so there has been a COVID-19 testing facility named One Bataan BGHMC COVID PCR testing facility. And in order to maximize this PCR testing, our municipal health office through the LCE and MHO entered into a tripartite MOA wherein Dinalupihan Municipal Health Office is in charge of storage, transport, and submission of specimens, submission of documents, and scheduling and conduct of mass testing. Next slide, please. So as a result, we were able to expand our localized and targeted mass testing, and we were able to conduct daily testing for COVID suspects and close contacts from Monday to Friday. And we're also able to conduct weekly testing among frontliners, not only the healthcare workers, but also the barangay officials, BFP, PNP, and VPs, and the like. So it is made free through PhilHealth. It has a quick turnaround time of around 1 to 3 days, and it is strategically scheduled during the week so as not to hamper the health operations in the community. Next slide, please. So, of course, not to be missed are the routine and special medical services and health programs. So, next slide. So, we have identified the vulnerable population of our community for screening and medical checkup. So, particularly Number one, the TODA and the Jeepney drivers, because they are considered as high spreaders due to their high contact with different members of the community, as well as the frontliners. So next slide. So this is the general scheme of our program, free medical checkup and laboratory exams for frontliners. We have examined 2,000 plus Pedicab, TODA, and Jeepney drivers, as well as 500 plus LGU employees and workers. Of course, we have the health protocols and the minimum health standards. We pre-screen them using through the midwives and the BHWs. And depending on the age and the comorbidities, we provide and request for laboratory exams, care of the district hospital. And once they return, we take the vital signs and medical checkup, not only the prescription, but also the counseling and the follow-up in the RHU for integrated management of their condition. We also provide passenger log sheet for contact tracing and hygiene kit for the TODA drivers. Next slide, please. So these are the examples of minimum health standards enforced during our municipalities' activities, such as the appropriate health screening, temperature scanning, and foot baths, and no face mask, no entry policy. Next slide. So next slide. So of course, not to be missed are the partnerships that we have formed with external organizations, ROJ, Hosan, and HelpThru included. And we have also partnered with Zwillig Family Foundation and joined them as they conducted 4 modules of community-based management training for COVID-19. Next slide, please. So examining the root cause analysis of infection among healthcare workers. So first is, of course, the lack of personal protective equipment, which is why we have purchased PPEs and received donations from NGOs, fortunately, and we have rationally distributed the PPEs. So another root cause is the exposure to infected patients, which is why we employed innovative ICT solutions such as cellular phone and engineering solutions such as swabbing booth, foot baths, and the like. Next, please. So another factor, which is the poor infection control, which is why we have trained our frontliners regarding the proper donning and doffing of PPE. And we have also participated in several online webinars on infection prevention and control. Our LGU has also invested in additional sanitary inspectors, which can really monitor the cleanliness of the different health facilities and LGU offices. So for the pre-existing medical conditions of some of our healthcare workers, we have adopted flexible workweek schedule, free shuttle, free medical checkups and laboratory testing, as well as purchase and distribution of additional medicines at the BHS and RHUs. We have streamlined our referral system and adopted a flexible work week. Next, please. Next, please. So for our key result areas, for the preparation phase, we have set up our surveillance, monitoring, and referral system to COVID-designated hospitals, purchase PPEs, medicines, and supplies, and mobilize different departments for social safety nets and monitoring of entry and exit of people into Dinalupihan. Next slide. For the mitigation phase, we have established social measures such as prohibition of mass gathering and social distancing, of course. We have also established social media announcements, provision of food packs per household, and continued regular meetings with the IATF. Last but not the least, for the response action, we had activated the Be Heard and forced quarantine measures, operationalized the Test COVID Center, activated referral system for testing of suspect and probable cases, conducted mass contact tracing of COVID-confirmed cases, and also coordinated with funeral parlors for proper management of the dead. Next slide, please. So for the performance indicators, so far the number of healthcare workers infected with COVID-19 or who died of COVID-19 from April 1 to July 15 is 0, and the number of tested COVID-19 suspects is 235 as of June 6, 2020, while the number of healthcare workers who were tested for COVID-19 is 68 as of June 6, 2020. Next slide. So these are the evaluation and monitoring tools that were utilized to monitor our initiative. Next slide. So this is the timeline. So as early as pre-COVID, we have established our Municipal Epidemiology and Surveillance Unit through a municipal resolution signed by our LCE. And we have also created a disease surveillance Facebook Messenger, not only for COVID, but for other emerging diseases. On February and March, we have conducted the different mitigation and preparation phases of our project. Next slide, please. So for April and March, we have identified, visited, and conducted orientation and training of frontliners on infection prevention and control. We have also designated Bataan General Hospital and Medical Center as a COVID center in Bataan and intensified IEC on social media. For May 2020, we started a localized targeted mass testing for frontliners, and we have continued orientation to barangay officials regarding contact tracing and other programs of the municipality. Next slide, please. So for June and July, with the start of the GCQ and with the rise of the cases, we have launched the RT-PCR laboratory and formed a MOA. And as of July 2020, we have also oriented religious leaders on the minimum health standards under the new normal. Next slide, please. So for the results of implementation, most of the key result areas were achieved, and most, if not all, of the health staff are really adhering to the work policies and infection prevention guidelines. Even the guards are trained on the minimum health standards, and health staff, including BHWs, are adept at using simple ICT solutions such as cellular phone for the daily monitoring of patients. However, there is still much to be done, from the expansion of testing to the provision of adequate quarantine facilities to the COVID asymptomatic, to even ensuring utmost protection to our provincial borders and instilling a behavioral and mindset change that will last even for the years to come. So next slide. So in summary, it is important to establish an LGU-led approach to people-centered COVID-19 response. Healthcare workers are an integral part of the fight against COVID and hence should be given due importance and protection. There is value in providing institutional as well as community and social support for frontliners, and systems and plans have to be established at the local level. So with that, thank you very much for the opportunity, ROJ, Hosen po, Broads and Sisters, as well as HelpThru. Thank you po for the opportunity, and thank you po for the donations that you gave us. So that is all. Good evening po.
Good, thank you
Wow.
for the presentation. Maraming gustong bumati sa iyo, Doc Jonah. Doc Jonah, yan, from Sir Benedict. Congrats daw.
Daming
Sabi ni
fans.
John.
Thank you.
Dami mong fans. Sabi ni Cynthia, great job, Dr. Mandak. Yan.
Mother.
Mapapasana all ka na lang sa strategy ni Doc. Ba? Grabe. Yan, thank you so much for the presentation. Yeah. Thank you. Ann?
For our
Thank you,
next
Doc.
presenter, she is from Tinglayan, Kalinga. Let's welcome Dr. Sandra Lynn Dupal. Andyan na ba si Doc, Chico?
Yes, she's here. Ayan. Hello, Doc. Hi, Doc.
Hi, Doc.
Good evening, Doc.
Sandra.
Mukhang hindi naman kinakabahan.
Yes po.
Aba, dapat lang kabahan. Of course, remind lang natin, no? Ang winner ng presentation na mananalo is mananalo ng 75,000 lang naman. For our first place, how much ang first place natin?
Ang first place natin is
50,000. For second place, 25,000.
25,000 ang gold. Ay, diba?
75,000 para lang naman sa winner. So, gabi yun. Maraming matutulungan yun. So again,
May pressure
Doc
ni
Sandra?
Dr. Sandra.
Kaya nga, Doc Sandra, yung PowerPoint presentation mo, is it ready now?
Yes po. Okay.
Can you screen share now?
Yes po. Okay.
Sabi niya pala ni Jen, comprehensive. Aba, comprehensive. Di ko nga alam gaano gamitin yung word na yan eh. Alright, Doc Sandra, the floor is yours.
Okay po. So, good evening, everyone. I'm Dr. Sandra Lynn Alunday Dupali of Tinglayan, Kalinga, and I will be presenting the design and development plan against COVID-19 in our community. So, for the situational analysis, our province of Kalinga is composed of 1 city and 7 municipalities with only 5 district hospitals. And our provincial hospital is a level 1 facility with a total bed capacity of 100. And it serves as the end referral center in our province. So during the early months of the pandemic, DGHMC has been the only accredited confirmatory laboratory which caters for the whole northern region. So this is located in Baguio. Kalinga Provincial Hospital, before COVID pandemic, has already been catering 200% more than its intended bed capacity. So for Tinglayan, Kalinga, it is a 4th class municipality with no hospital in the municipality, and our nearest hospital referral is 2 hours from the RHU. It is also one of the main entry point of our province, lack of manpower and transport vehicle, and limited phone network, wherein both our main checkpoints have no cellular phone signals. The RHU is under renovation also, hence the old birthing clinic is being utilized as a temporary RHU, which means that we are using a very limited space at the moment. So for the cause mapping or root cause analysis, lack of concern to self, wherein we think about the patients before self to the point of disregarding precautionary measures. Lack of manpower, which will lead to overwork and weakened immune system. Lack of PPEs readily available due to delayed budgetary release. Lack of regard to authority by LSIs, which may lead to protocols being bypassed. All of this may lead to increased risk of exposure and infection with COVID-19, which may lead to death of our healthcare workers. So for the goal, COVID-19 free or COVID-19 contained community through a well-designed program, and our specific objectives is that there is 0 confirmed cases of COVID-19 in the municipality, no patient dies of COVID-19, and no health workers die of COVID-19. So for the implementation plans, triaging at the checkpoint, as you can see in the picture, we have our DIY temperature check. The setup is designed to promote the least contact with our LSIs. So this setup will serve as a backup defense from the infection, since some healthcare workers might have lapses in the proper use of their PPE. Triaging will help in the contact tracing and coordination with the receiving barangays also. So rapid testing at the checkpoint serves as the basis for decision making in the utilization of the municipal isolation units. If RDT is reactive, they will be sent to the MIU and be subjected to swab testing. Others would be sent directly to their respective BIU for monitoring. So blending cultural practices with laws. So we have our TOR. During the announcement of ECQ, many constituents did not fully understand what quarantine means. Hence, the municipal IATF considered blending it with their culture for easier grasp of the community. TOR is a tradition during harvest wherein they set one day as a rest day wherein no one is allowed to enter or to exit their barangay. Violation would mean bad omen shall be upon the violator. This is the equivalent of the ECQ but is modified to more than just one day. So purchase, as you can see in the right picture wherein the man is putting the purchase, it is a symbol that a TOR is in effect. All of the natives are aware of this and even the neighboring municipalities. 24/7 RHU with skeleton workforce. So even before the COVID-19, the RHU has been open 24/7 for the birthing home. However, since there is no hospital in the municipality, it also functions as an emergency room that caters to all kinds of medical concerns. Since the pandemic can cause exhaustion, we have set a skeleton workforce schedule to give some rest for the staff. However, everyone is still on call when the need arises. Leveling of referral system. So all patients must be seen by the barangay midwife before coming to the RHU, so that manageable cases are no longer referred to the RHU. This is to limit the exposure of our healthcare workers in the RHU, as well as the unnecessary exposure of patients to healthcare workers who have their duty at the checkpoints. So LGU isolation unit will have designated RHU staff for duty during the entire quarantine. So 2 staff will be assigned in the quarantine area for the whole 14 days, and after which they will undergo quarantine, and another 2 staff will replace them if another LSI will be admitted in the isolation unit. So this will limit the number of exposed healthcare worker if ever there is a positive result of swab testing. Hence, will save manpower if only 2 will be quarantined. Health workers who are elderly and has comorbidities are prohibited to see patients. So they are assigned in other areas such as managing of food supplies for frontliners, donations, reports, and the like. This will save more manpower and resources if we protect the high-risk frontliners. Another one is the extending help, wherein when you protect your neighbor, you also protect yourself. So we have launched a private donation drive during the early days of pandemic, wherein no PPEs were readily available to the government frontliners. The fundraising has raised not only funds but awareness of the people on the needs of our frontliners. With this, we were able to distribute PPEs province-wide. Pinnachang or Binnadang is also a tradition which means bayanihan in the province of Kalinga. For the solid waste management, proper disposal of hazardous waste are strictly implemented. RHUs and BHS septic vault is being utilized as the final disposal for all the hazardous waste, since the terrain in Tinglayan is very mountainous. So we don't have the proper waste disposal. Captain of the ship, so the head of the office must always be open to extend help to his or her constituents. So some people do not listen to their midwives, barangay officials, etc., since they think that they are just their kabarangay. However, showing support to them and backing them up as the head of the healthcare team, this will boost their authority to their constituents and further push them to do their job despite disappointments. Support system. So sometimes, aside from our own family does not understand the stress of the healthcare team. Hence, support from fellow healthcare workers is very vital since we share the same experience. Our SB on Health also composed a song in a local dialect to show support and appreciation to our frontliners. The municipal mayor also initiated a one-night debriefing for our frontliners wherein we were able to unload some, if not all, of our stress. Planned homecoming, it promotes a well-organized and well-coordinated arrival of LSIs. This will help the LGU prepare all the needed BIU and logistics. So scheduling promotes the separation of LSIs from red areas and white areas in order to avoid unnecessary exposure at the checkpoint triage area. Social media, so this is connecting people to enhance the timeliness of updates, and it is for better coordination since most of our LSIs are students. Interlocal health zone, so we have the Chico River Interlocal Health Zone, an interprovincial LGU cooperation with Mountain Province. This is just to maximize connections for better referral system and more source for assistance since Mountain Province has a tertiary hospital. Adopting innovative practices of other places. So fighting COVID-19 is not a competition between municipalities, but is a fight wherein we must do it hand in hand with each other. As the mayor of Pasig said, kopyahan na ito, when he adopted strategies of other cities that are applicable to theirs. Empowering the barangay, so the municipal mayor coordinated to the barangay officials to prepare their own temporary isolation facilities since the DepEd has already took over the schools used for isolation. Letting the barangays take responsibility for their own isolation units will lessen the burden of the LGU, wherein they can provide assistance to more barangays. This will also promote the bayanihan spirit of the community and preserve more resources of the LGU. Strengthening of contact tracing, so we have our passengers declaration form. This is to promote easier contact tracing and to check social distancing with the number of passengers. Isolated barangay lockdown. Once a person is identified to be positive or is a close contact of a positive patient, the barangay where he or she lives will be locked down through an executive order until all necessary measures are done to make sure that the place is safe to open again. It will also promote a sense of responsibility and vigilance to each barangay. So the results of our implementation, all of our frontliners were provided with PPEs, no cases of COVID-19 in the municipality. Frontliners were given time to rest through skeletal workforce schedule. No frontliners were reported to be burnt out. Minimum number of frontliners were exposed. So lessons learned and realizations. Public health has long been neglected. Policies needs to be strengthened. Interagencies must unite. The grassroots are the most affected in terms of lack of facilities. Logistics are lacking at RHUs to sustain the needs of a community during lockdown, even our hospitals. Contingency plans must be in place. This pandemic have also shown that frontliners, especially the healthcare workers, have been abused in so many levels that it needed a pandemic for the world to notice. This, however, did not stop our healthcare workers in serving the people, because we believe that a service to people is a service to the Lord. However, the best strategy one can ever do is to pray to the Lord for guidance and protection always. At it says in Matthew 7:7, ask and it will be given to you, seek and you will find, knock and the door will be opened to you. So, dasal-dasal lang guys. Thank you and God bless us all. Thank you po sa lahat ng donors and to all the people behind this project. And of course, sa lahat ng mga support system ng ating mga healthcare workers, salamat po sa inyo. And hello to my family in the living room. Thank you po.
Shoutout sa family mo. Ayan,
Hello.
galing. I like the Bible quote for sharing that. So everything of course
Galing. Doc, parang
possible
hindi
with the
naman
love
talaga
of God.
kinakabahan.
Oo.
Thank you po.
Grabe, Doc. Thanks, Doc. Have a good day.
And I'll be presenting our experience in Dingalan, Aurora. This is the community mobilization in the time of COVID-19. Next slide, please. Dingalan is a third-class municipality in the province of Aurora with around 25,000 people. And then the World Health, next slide, sir. The World Health Organization has declared COVID-19 a public health emergency of international concern, and the Lancet Commission said that pandemics such as this may easily overwhelm the LMIC, such as the Philippines, the LMIC health system. It mentioned that the severity of the COVID-19 pneumonia poses great strain on critical care resources in hospitals, especially if they are not adequately staffed or resourced, or more importantly, protected. Next slide. You should be seeing now the COVID-19 status of Dingalan, Aurora. And the LGU has held the line for COVID-19 to spread from nearby municipalities and provinces. The stringent implementation of the quarantine protocols of the COVID-19 precautions had brought them 0 cases up to this date. Next slide, please. However, some were left behind, especially locally stranded people in the checkpoint. Next slide, please. As mentioned in Oxfam, communities must be the center of every response. The people should be asked for the solution in their overarching problems, and communities are always the expert on their own lives and needs and will be better placed to advise on how to engage. Communities are resilient and will always find solutions. This is how community-led initiatives bring great impact to the needs identified and how it will be addressed. So with this, the Relief Kitchen initiative was started. It was a community-oriented endeavor that addressed immediate needs of the people stranded, next slide please, stranded in the quarantine areas. This was started by my wife, Nurse Maisel Dumaya, Ms. Raisa Yabut Policarpio, Mr. Ray Tipay, and Mr. Herald Villarca with me on the background. This nonprofit project that aimed to provide nutritious food for the people and for the poor. And their setup is to promote the activity to well-doing. The setup is to promote the activity to well-doing families and involve the government and the private sector in helping the people. So here are some pictures. Next slide. Their food serving was laid on banana leaf plates to decrease carbon footprint and trash. The project also mobilized the community in a state of bayanihan where everyone is accountable in each and every one. They had rotating kitchen sponsors from Central Poblacion going to the geographically isolated disadvantaged area, even to the Dumagats. Here's their outcome. Next slide, please. They had 4,362 packed meals for everyone, and they mobilized 25 to 30 private and public kitchens, and they had 65,900 pesos in total collection. Meanwhile, the RH, or the Rural Health Unit of Dingalan, Aurora, where I previously worked, under now Dr. Lani Cebedo and my wife, Nurse Maisel Dumaya, who is the public health nurse. They mobilized the Rural Health Unit to be a COVID-19 ready facility. Precautions were done with limited consults, physical distancing on queue, foot bath on entrance, one-way patient traffic, separate entrance and exit, physical barriers on consultation tables, hand washing stations, reinforcements of use of masks and disinfection practices. The personal protective equipment, which was given by the ROJDonors. Next slide, please. The MuRelief and HelpThru was delivered to the municipality of Dingalan. Since I was a previous municipal health officer at that area, I partnered with the present health workers in the Rural Health Unit and the provincial community hospital there to give capacity building activities and lectures, as I am working as a general surgery resident at the Philippine General Hospital. So I was limited with my interaction with them. However, challenges went in the way. Next slide, please. And the original plan was hampered. I was not allowed to go through the barrier of Dingalan, Aurora. A bit the clearances and the letters from the local chief executive. However, since physical capacity building is not possible, teleconsultation was done. They forwarded to me their queries, especially for surgical cases. And right there and then, I give the management for the patients. One of the patient had NPCA, wherein we manage it, wherein I advised them to have core needle biopsy and thereby having a radiotherapy at the nearest CT, wherein they observe precautions with COVID. Also, this patient with inguinal hernia, yun. Basically, ina-advisean ko na sila para kung hindi naman emergent, wag na pumunta ng hospital. Ito na lang yung pwedeng gawin. Especially yung mga may biliary colic na mga sakit. Or, next slide please. Okay, my next slide was just done today. 2 weeks ago, I operated on a patient who is a 15-year-old female na kung saan lumapit, nagkataon na pwede na akong dumaan sa Dingalan. So, I spent at least 3 days there, and some people knew that I was there, and they asked me kung pwede ko daw tingnan yung anak niya. The patient was a 15-year-old female with a left breast mass na nanggaling pa 3 hours away from poblasyon. So, yun, left breast mass, in dire pain, tapos nagpapanik na yung nanay ko anong gagawin. Lumapit sila sa amin na umiiyak. Tapos, ayun, na-reassure lang naman namin sila, and then I operated on the patient. And happily, habang niyakap ako, nagpasalamat sila na, oy, pwede pala yung ganun. Kahit na COVID, kaya pa rin natin magbigay ng services for the people. So this was brought about by teleconsultation and close interaction with the healthcare workers and the trust that you can deliver or you can decide right there and then what's good for the patient. So with that, maraming salamat. The collective initiative done, next slide po, in Dingalan, Aurora made it successful for the municipality to have 0 cases without a health worker being infected. Sustainability of the projects will be possible with a proactive community, which was done, and who realizes their needs in the midst of this pandemic and possibly in the future. Maraming salamat. Thank you.
All right. Good job. Thanks for the presentation, Doc.
Yay!
Thank you. I'm really impressed how, kahit may barrier na, kahit may tali na, you still found a way to treat your patients, and that's, dedication
Yes.
right there. So,
Yeah,
just like
galing,
yun.
Doc.
Galing. Alright, Doc, thank you so much.
Thank you.
Thank you,
Thank
Doc
you.
Brent, and good luck po.